your prescription for a healthier and happier life. Here's your host and publisher of the Tonic newsletter, Jamie Bussin.
Lisa McColeman is a retired teacher of nearly 30 years, a lifelong community volunteer, and co-owner of a family farm near Fergus, Ontario, where she and her husband have lived and worked for more than 2 decades. She's the proud mother of 4 children and grandmother of 3 grandsons. Lisa was diagnosed with pediatric onset hypophosphatasia, otherwise known as HPP, a rare genetic bone disease at the age of 52. She's sharing her experience to help raise awareness of the condition and her fight for access to treatment that she needs to survive. Dr. Adachi is an emeritus professor of medicine at McMaster University and one of Canada's leading experts in osteoporosis and bone health. He has authored more than 650 peer-reviewed publications and is internationally recognized for his contribution to osteoporosis research and clinical care. His work has earned numerous national and international awards, including honors from Osteoporosis Canada and the International Osteoporosis Foundation. Welcome, both of you.
Thank you for having us.
Thank you.
Lisa, I understand it took more than 50 years to finally receive a diagnosis of HPP. Looking back, what was the journey like, and what did it mean to finally have a name for what you're living with?
Okay. Well, as a child, I really knew no different than the life I was living. But looking back now, I see I had a lot of respiratory problems. I was very clumsy, uncoordinated, had poor teeth, and many fractures. I grew up in a home where you did not complain, and so there was no space for pain or injuries. So I remember that I was told that I had low alkaline phosphatase levels and low bone density when I was in my adult years. I had doctors wondering out loud, like, what could it be? But it wasn't until Dr. Adachi took me on that he was able to finally diagnose me with HPP.
And now that you know what you have, what does that mean to you?
So knowing what I have, my first thought was for my children, honestly, as it's a rare genetic bone disorder. And I remember being in the car after Dr. Adachi giving me the diagnosis and actually Googling it to try and figure out, like, what could I possibly have passed on to my kids? But thankfully, they were tested and none of them have hypophosphatasia. So initially I had, the kids are fine. I had hoped that knowing what I had would be the first step to healing. But unfortunately, that hope is disappearing with each denial.
Dr. Adachi, HPP is a rare disease that many people have never heard of. Can you explain what it does to the body and why an early diagnosis and timely treatment can make such a big difference?
Well, as you pointed out, HPP is a serious genetic disease that leads to poor mineralization of bone. And as a result of that, we see fractures and muscle weakness. It can also affect the kidneys with calcification of the kidneys, kidney stones, and in children, poor lung function and seizures. As a result, early diagnosis and treatment is essential in preventing these types of complications. For Lisa, we're advocating for treatment to prevent further fractures and to help with the muscle weakness and the accompanying fatigue. For Lisa, this would mean that she would have to live with less pain, with better muscle function, and with less fatigue. It would improve her quality of life. When we think of fractures, we think of typical drugs for osteoporosis like the bisphosphonates and denosumab. Unfortunately, these drugs do not work in HPP and, in fact, may increase the risk of having further fractures, like fractures of the thigh bone and stress fractures of the feet. As a result, the only therapy that we have for HPP is this drug called Strensiq.
Lisa, despite finally getting the diagnosis, you found yourself in a position of knowing there's an approved treatment available, but being unable to access it because of Ontario's funding criteria. How did you react when you learned that your age and not your medical need was the reason that the request was denied?
How did I react? Oh, man. There were lots of tears of frustration and anger. First, I felt frustration that there was a treatment available, but I was being denied it because of my age. That just felt discriminatory. There was frustration that Dr. Adachi had been applying for years for me to get on this treatment, and meanwhile, my body continues to deteriorate, as Dr. Adachi mentioned, with more fractures and more pain. Honestly, I've tried to keep hoping that if we just talked to the right person, that they would see that my life was worth saving and that it would be approved. Strensiq is the only option for me. So looking at pain management now is what my other specialists have offered, but nothing seems to be working. I'm going to lose more and more of myself with every fracture, and the pain's only going to get worse. And, that's a terrifying and dark space to live in. I've been holding on to hope, but also the reality that if I don't get Strensiq, I have to prepare for the future. And that means I've had to have really tough conversations with my family. I've been told by my medical team of specialists to prepare an advanced care directive. And respecting my choice, a palliative care doctor has been brought onto the team to now help navigate MAID for me. With Strensiq, I have a life. Without it, basically, it's a death sentence.
Dr. Adachi, you've prescribed Strensiq for Lisa and requested an exceptional review, which was denied. From a physician's perspective, what message does that send when clinical judgment and patient's individual circumstances don't seem to be enough to secure access to an approved treatment?
I found this really, really very frustrating. We as physicians, we take a look at the science and we take a look at all the work that's been done to help us understand why people develop HPP. We then go on to develop therapies for conditions which we thought we would never have a therapy for. And then we're elated when something becomes available. And then we go through the frustration of trying to get that therapy for our patients. And only, when we are denied over and over again, does it become even more frustrating. And you really get quite angry. I find it particularly frustrating when we sent numerous letters to the government and to the Minister of Health explaining the dire circumstances that Lisa is living under, and to receive the same form letters declining our request over and over again makes you wonder if they've even read the requests that we've made.
Yeah. Lisa, you mentioned about the pain and the fractures that don't heal properly, and how it's impacting your independence. What does a typical day look like for you now, and how has the disease changed your life?
Oh, wow. Perhaps the best way to tackle that would be to think about what was my life before these last fractures. And, I was really an active person. I was active on the farm. Our farm was very busy, so I'm active taking care of animals, feeding chickens. I could lift 50-pound bags of feed. I was throwing bales in the mow with my kids. Every day I started with exercise, and that was a big part of my mental health and my physical health for me. I wanted to be strong as I grew older. I could hug my grandchildren and lift them up, and I had a big part in childcare with our older grandchildren in their younger years, and I was able to run and play with them. At the end of the day, Rob and I would go out and socialize. I was active in the community, and we had just started traveling in our retirement. Now, what is the world like? Since I experienced the last 3 compression fractures in my spine, my days all start the same. It's pain meds, and then a heated pad and a chair are needed. I can no longer lift up my grandchildren, and for that matter, I've never ever lifted up my youngest grandson. I've had to give up most of my volunteering. My world is getting smaller and smaller. I can't get a proper hug or give a proper hug. I have to stretch out, lay down multiple times a day. So I feel like my world is bed to chair to outside, maybe on the porch. It's isolating and lonely to deal with this, and realizing that people don't want to hear that what I need, I'm being denied by the government. They don't want to think of our government that way. And many people just don't want to listen to that. For me, sleep is a big thing. I have opioids that are helping me sleep at night. I've been given permission to increase them during the day, but I'm holding out because I'll lose what little independence I have left. I used to be able to put my head down, persevere, work hard, and I would be able to get things done. Now, if I push myself too hard, I lose more ground, so I struggle with feeling useless and not being able to pull my weight here on the farm. Physically, I've lost almost 4 inches of height over the past year, and it's impacted all parts of my body. I need a walking pool or my service dog now all the time so I don't fall. And I've had an amazing team of specialists trying to help and support me on this journey. And we've tried everything that's been suggested. I can no longer look forward to traveling. Life's becoming smaller and smaller, and I live in fear of the next fracture. And with every fracture, I'll lose more height. I'm going to cause more problems. And it's hard to be hopeful in that world without Strenswick. With Strenswick, it's a totally different world. And I would actually have a future. So in short, my life's been totally changed with hypophosphatasia. Without Strenswick, I will die a slow, painful death where I'm going to lose my ability to walk. Breathing's going to get harder and everything will be harder. And I will be totally dependent on my husband. And that does not sound fair.
Yeah, I'm very sorry about that. Lisa, we have time for one last question, and that is, if you had the opportunity to speak directly to the decision makers responsible for funding this treatment, what would you want them to understand, not just about your case, but what it means to have timely access to treatment or could mean for people living with rare diseases in Ontario?
Thank you for that chance. I would say, Minister Jones, I realize that I am only one of many Ontarians for whom you're responsible for each day, but my name is Lisa. I'm a 58-year-old retired teacher, farmer, wife, and mom, and grandma. I've worked hard all my life, striving to meet everyone's needs in my family and the community, trying to give more than I ask. This is really tough. I love the life that we built together with sweat and tears. Being diagnosed with hypophosphatasia and then denied the life-saving treatment has been devastating, not only for me, but my husband and children. I've received no support from the local MPP, nor any luck with the Ministry of Health. As it stands right now, my children are going to grow up into their adult years without me. My grandchildren will grow up not knowing me, and my husband and best friend will be without me, and he's going to be heartbroken. Knowing Strensic is successful treatment for my rare disease, but being denied it is cruel and inhumane. Being offered advanced care support to help me die rather than the treatment I need to live is absolutely too brutal to accept. It's a deeply disturbing message to Ontarians that this is the state of our present healthcare system. And I ask that you consider me and folks like me with rare diseases who need specific treatments to live and what our lives are truly worth. Thank you.
So sorry. Thank you both for coming on the show today.
Thank you very much for the opportunity.
Yes, thank you very much.
Thanks to all my wonderful guests, Dr. Gordon Chang, Alex Snyder, Chantal Bisson, Lisa McColeman, and Dr. Rick Adachi. And thank you all for listening to The Tonic. You can listen or download this episode as a podcast with full show notes, contact information for our guests, and links at thetonic.ca. To find out more about the show, you can always follow us at It's The Tonic on Facebook, Instagram, or Twitter. For more timely, up-to-date, and accurate health and wellness information, subscribe to The Tonic newsletter. Now distributed once a week, The Tonic newsletter with content curated personally by me will keep you in the loop. There's contests, prizes, insider scoops, and so much more. Visit www.thetonic.ca and sign up today. If you're interested in providing feedback or suggesting topics for the show, you can always email me at jamie@thetonic.ca. On our next show, we'll discuss the health and wellness issues that are important to you. Until then, this is Jamie Bussin, wishing you a healthy and happy week.
This podcast is proudly produced and presented by the Zoomer Podcast Network, home of great podcasts like Marilyn Lightstone Reads, Idea City on the Air, and The Garden Show.